When it comes to full-service orthopedic care, look no further than the multiple Campbell Clinic locations here in the Mid-South. They're sponsoring our conversation with Dr. Christopher Thomas Holland today, and he's here to talk about something that impacts a lot of people, arthritis. Thanks for coming in.
Thank you so much for having me. Very excited to be here.
Yeah, so what's arthritis of the hip or knee joint? I know some people know this personally.
Yeah, exactly. A lot of patients may be experiencing this. Arthritis can affect many large joints in your body. Really, hip and knee is what we're going to talk about today. And what you start to see is breakdown of that cushioning in the joint. You know, there's inflammatory arthritis, there's arthritis after trauma, but really wear and tear arthritis is what we see the most. And as you go through life and time progresses, you can see on the screen here that you start to lose that joint space. You start to see that cushioning go away, and then you start to see this bone-on-bone contact. And what you'll start to see on the screen as well is, as we go through, on the left, you have a normal joint space in a hip. That's a hip x-ray on the left of your screen. On the right, you see that narrowing or that loss of cushioning that I was talking about. Your body is very smart, tries to lay down new bone, and it forms these things called osteophytes. That's the new bone that's forming there to try to cushion that joint from having the pain that it had because you lose that cushioning on the surface. Now, this can affect your hip, but it can also affect your knee. And what you'll see on the screen there is a picture of a knee that's also going through that same process where you start to lose that joint space. The x-ray on the left shows us a normal joint space where you have space on the inside, space on the outside, but on the right of your screen you see that loss of joint space where you no longer have that nice cushioning. Patients really start to experience pain, difficulty when they're walking around, when they start to develop the arthritis that you see on the right of the screen there. And this is just a cartoon rendering of the same thing. Really loss of that cushioning, new bone forming called osteophytes, bone spurs, and then that joint space narrowing after you see that cartilage loss.
Just imagining the pain just sounds really awful. What are some of those early signs so that you can do something before it gets too bad?
Yeah, absolutely. Some of our patients will come in and tell us, you know, some of the first things they have difficulty with is trying to reach down, put your shoes, put your socks on. The hip or the knee just won't rotate like it used to. You know, walking to the mailbox now becomes a chore. You're going to the grocery store. You used to be able to walk all the aisles, but now when you get back to the car, you really start to have some hip pain, some knee pain that's limiting you, or you can't take the dog out on the walk like you used to be able to. You used to be able to go 4 or 5 blocks. Now when you get to the end of the street, you want to turn around and come back to the house.
Yeah, and what are some of the new technologies that are out there that can help with the hips and knees?
Absolutely. So there's a lot of new, exciting, emerging technologies. Some of the things that we offer at Campbell Clinic is really navigated or robotic surgery. We've applied that to the knee as well as the hip, and what you're seeing here is actually a picture intraoperatively of what we do when we collect an image-free, navigated experience for the patient undergoing total knee replacement surgery. We actually map out the femur, and you're seeing a rendering of a specific patient's femur here. You're going to see also a rendering of the tibia that we map out intraoperatively, and that you can see on your screen there. What that allows us to do is then take those coordinates, take these renderings, and really put the implants in a very specific position for that patient. It is amazing, and you can see that here on the screen where we can fine-tune our rotation, our placement of the components, really to perfect knee replacement for the patient.
Okay, so say those signs that you mentioned, you're noticing those signs, who should they see?
Yeah, absolutely. So we're super excited. We have care pathways all the way from very early arthritis and up until you need total joint replacement surgery. You know, once you start experiencing these early signs of arthritis, not everyone needs a total joint replacement right away, but we have healthcare providers in place at Campbell Clinic that can offer you multiple treatment options that can start from with those very early signs to get you back to a high level of activity, doing the things you want to do. And we can really help navigate as a partner through that entire care pathway with hip arthritis, with knee arthritis, taking you to surgery and through surgery to have a really wonderful curated experience.
I really feel like I just went to medical school. That was amazing. Thank you so much, Dr. Holland, for just walking us through that. I really feel like I learned a lot. And thank you to Campbell Clinic for sponsoring our chat today.
Thank you very much.